The famous person I'm doing my biographical speech on today will be Dr. Virginia Apgar. The Apgar score was created by the famous American obstetrical anesthesiologist Virginia Apgar in 1952. This was to decrease the infant mortality rate as much as possible according to the National Library of Medicine website. Virginia Apgar was born June 7, 1909 in Westfield, New Jersey, of Charles and Helen May Apgar. As she was growing up in her family, Apgar always knew she wanted to become a doctor. This was based off of her father. He was an inventor and astronomer. As she graduated from Westfield High School in 1925, she went straight to Mount Holyoke College, majoring in zoology. After graduating from Mount Holyoke College and getting her Bachelor's of Art degree in 1929, she attended Columbia University College of Physicians and Surgeons to begin her medical training. And in 1933, Apgar received her Doctor of Medicine degree and started a 2-year surgical internship at Presbyterian Hospital. Now, let's take note that Virginia Apgar, a woman, is participating in a surgical program in the mid-1930s while the Great Depression is going on during this time. As the U.S. National Library of Medicine website stated, Apgar's mentor, Alan Whipple, worried about her and was concerned about her being able to become the surgeon that she wanted to be. And he suggested that she should participate in the anesthesiology department instead. So after very hard consideration of the advice her mentor gave, Apgar decided to go the route he introduced to her. And she trained a year in the Presbyterian Nurse Anesthetist program and did her residency programs. She did them at Ralph Waters at the University of Wisconsin and Emory Roofing at New York's Bellevue Hospital afterwards. When Virginia Apgar residency ended, she went back to the Presbyterian Hospital in 1937. She became the director of a new division of anesthesia within the Department of Surgery. Also, she was the first woman to head a division at the Presbyterian Hospital. And by 1949, she became the first woman professor at the College of Physicians and Surgeons of Columbia University. This was stated by the Columbia University Irving Medical Center website. This is when she became more focused on her research on the obstetrical anesthesia. And in 1952, that was when everything was about to change for Virginia Apgar. Dr. Virginia Apgar created and developed the Apgar score in 1952 for newborn babies that were just born into the world. She was so intrigued and captivated by the effects of maternal anesthesia on newborns, according to the National Library of Medicine, that she just had to find an idea, a procedure, a way in general to help the newborns in some way possible. Apgar was very passionate about the neonatal mortality rate back in the 50s, and she wanted to help out and contribute as much as possible in having it disappear or at least decrease down as much as she could help it. The Apgar score is a series of 5 different tests run on newborn babies as soon as 1 minute and 5 minutes after they are born, as Anesthesia and Analgesia Journal of Virginia Apgar stated. The 5 tests Dr. Virginia Apgar consisted of for the Apgar score were checking for the baby's appearance, which is skin color, pulse, which is heart rate, grimmage, which is reflex irritability, activity, which is muscle tone, and respiration of the baby, as stated by the Marshall Dimes article on Virginia Apgar. According to the Med9 Plus article, the total score the baby can get from the Apgar score is between 1 to 10. And the higher the score, the better the baby is doing after birth. The scores between 7 to 9 are perfectly normal. If the scores are between 3 to 6, the baby is going to have to go to the neonatal intensive care unit, known as the NICU, to see exactly what is wrong and what is going on with the baby. The Apgar score is relatively still being used today all around the world, and it's a major contribution as a standardized test for newborns and their capabilities and or disabilities, and finding out early on before it is too late. The Marshall Dimes article also contributed to telling that the Apgar score and its effectiveness lies in part of its simplicity and mainly help to predict newborn survival and reduce infant mortality. Infant mortality is the death of an infant before his or her first birthday, according to the Centers of Disease Control and Prevention website. Infant mortality rate is the number of infant deaths for every 1,000 live births. Over the years, infant mortality rates has been decreasing every year. And in 2018, the infant mortality rate in the U.S. was 5.7 deaths per every 1,000 live births. But back in the 1950s, according to InfoPlease article, the infant mortality rate was 29.2 deaths per 1,000 live births. This is the reason Dr. Virginia Apgar was so adamant about the Apgar score and getting it out and around the world. The Apgar score contributed to why infant mortality rates were so low in the present and will continue to contribute to infant mortality rates in the future.